Welcome. This is the next in our series of talks from Topke, which is training osteopathic primary care educators. Create a series of presentations and tools to use for osteopathic medical educators. What we're going to talk about, I want to share with today, is the topic on using innovative osteopathic curricular tools. Do want to acknowledge that Dr. John Jones, who's the chairperson of the Department of Osteopathic Principles and Practices at William Carey University College of Osteopathic Medicine, was instrumental in helping develop the materials that we're going through today. There's a lot of things that is important. Curriculum is a very essential element in our training, and many of us have not had additional training or ideas with it. And hopefully we can share a few things today to help with that. I want to look at some of these uniquely around osteopathic curriculum that looks at osteopathic concepts, how that relates to it. We have to develop goals and objectives, and looking how do we develop those goals and objectives, and looking at different models that we can utilize for that and different methods. So use this as a point to get more references. There's a lot of material in the slides. I'm not going to try to read through all the things and go through it, but just hit the highlights, and this material you can come back to and take a look at as you're going through it. One of the areas we want to look at and encourage people is the osteopathic concept is central to being an osteopathic physician. As educators, as clinicians, there are so many opportunities that we can do to get that through to our learners. And sometimes how to do that is kind of a challenge. A lot of people say, how do I do that? How to go through it? From the basic scientists to the clinicians themselves. Also understand that sometimes people equate osteopathic concepts solely with osteopathic manipulation. It's not. There's osteopathic concepts, how we think, how we do things, that also are just as valuable. When we look at this, we look at osteopathic principles, and we look at osteopathic practice. And again, the principles run around the tenets, looking at the structure-function relationship. We look at the structural diagnosis that we have. We look at principles behind why does osteopathic manipulative treatment work? Why is it efficacious? Why is it helpful for patients? The practice itself is really applying that structural exam and also applying OMT when we're training patients and taking care of them. There's many settings that we're looking at this. Very much from the first year someone goes to osteopathic medical school to someone is at the end of their fellowship to seasoned clinicians. We're looking in the classroom, we're going through that. You may, in the midst of talk about a patient, present a patient doing that. You may also look at how a physician may work with structure, to modify function. So in these sections, we may talk about, how we're applying it in these settings, but also from the point we're evaluating patients and treating them using osteopathic manipulative treatment. When you look at education, different domains, there's first cognitive, affective, psychomotor. And we think about common terms that look at these areas themselves and what areas they address and what things they cover. So example, in cognitive, we look at knowledge, the medical knowledge. We look at how it looks at the mind, how people are thinking and looking at that, their intellectual skills. And most of us think of those areas. Affective is also the attitude in going through it, their emotion, their spirit, how they adjust, how they respond to things. But psychomotor is a little bit unique because it looks at skills. It looks at how the body, how they're handling themselves. And when you're doing a procedural skill with this manipulation or other elements, it takes a different level working with learners to kind of be effective with that. When we're developing terms that what we want out of learners and going through it, there was a term called Bloom's Taxonomy. And that's honestly changed. There was an old version, new version. It started, the base of this started with knowledge before. And to go to the highest thing was evaluating to make sure we could get that. Well, the new one is taking a whole different format. It's really look at remembering, going through that, and in the end, kind of creating. We're looking at, think of this as a learner in action and areas of going through that. We call it different ascending levels, So the fundamental level, kind of remembering things. If you recognize things, understand that. So it's a little more of the pedestrian level of going through it. It's not good or bad. It's worse from a novice and developing expertise. The goals in our learners today, and looking at core competencies, looking at other areas, they look at this development of someone moving that to developing a physician with developing expertise. So having fundamental knowledge, from fundamental knowledge, moving up to being competent, and then from competent, developing expertise. And these ascending levels, looking at remembering, understanding, applying, analyzing, evaluating, creating, as you move up those tiers, those things change the dynamics of what we're looking at. Kind of a busy slide here, but this is a reference from Oregon State University, Dr. Diana Fisher developed, and it really helped to reference that, how looking at multiple ways to look at these areas of Bloom's taxonomy and how to apply them, and recommend that these are one way you can to help advance your skills there. So let's take a look at now. We've got whether we're in a situation, whether we're going to be giving a lecture, running a course in one of our medical schools. We're going to be developing a rotation. Whatever we're doing, let's look at a way to incorporate osteopathic concepts. Part of it is that looking at the osteopathic core competency, which now is intermixed with the other core competencies, is looking objective, something that really addresses that. For example, if you look at structure function, you're looking at that tenet, how that might apply to it. Again, look at what activity that you can apply this to. And again, this could be anything that you're involved with, from, again, a course to seminar to teaching rounds. And think about how you can put some osteopathic concept into this area themselves and working through that. What do you want to take away from this? This is when you try to look at that 1 to 3 sentence themselves and kind of this purpose, and that purpose leads to goals. And again, goals are this very broad look. It's not, specifically, the outcomes is the objective of what we're going to do to get to that point. When you design themselves, I think one of the things learners, and you look at the educational literature, they've come back and said, gee, when they're not as successful, is expectations. To be successful is making those expectations very clear, what they're to do, the schedule of how that's occurring, what requirements. So simple things in that class, I'd like you to show up and be responsible. Here's, we're evaluating someone, we're going to evaluate you in this area themselves, what activities, what assignments we're doing to themselves. And, so they clearly understand what they have to do to progress. And then the key concepts you want to get out of that themselves. And the guidelines for them to be successful in that rotation. During this rotation, I expect you to do 10 osteopathic structural exams and treat 10 patients. At the end of that time, well, I've only done 8. Well, that's not meeting expectations. You 12. Well, you exceeded expectations, so you're going through that. Again, we referred to in the past more objectives. The new term is looking at is learning outcomes. So again, we're looking at action, education and action, and going through that. What do you want them to gain the knowledge? What do they want to learn from this themselves? Develop, again, that attitude that's going themselves, and what skills they need to make themselves. And look at those outcomes themselves and pick the areas that you want to for that. One way to approach this, which would be very helpful, is just to begin with saying, by the end of the course or by the end of this rotation or by the end of this presentation, I hope that you'll be able to, do blah, blah, blah. And those things are helpful because that way people clearly know what they're doing. It goes back to the old dictum, tell them what you're going to tell them what you've told them, to kind of reinforce areas themselves and going through it. When you look at themselves, you want to look at kind of desired behavior and then how it'll be evaluated. And desired behavior may be, looking at areas to enhance osteopathic concepts in specific ways, and then again, how they're going to be evaluated looking at themselves. When you think of the objectives, it may also be, this is an outcome, where you want them to be at the end. Again, think of the end in mind, like Covey was famous for looking at. Those things apply here as educators and helping our learners themselves. And again, I think we're pushing a lot at behaviors too, because we're looking at attitude and developing themselves. And you want to look at the outcomes and how you're going to measure that and themselves. If different from the requirements, you want to look at the level of performance that'll be acceptable. In other words, if you say, I'd like you at the end of this rotation to do 10 structural exams, that's created very clearly themselves. And you want to look at language that's helped with that. And we're going to look at some ways to help with that. When you look at objectives and how you're doing that, you may look at themselves, like identify, recite, and write 3 domains of education. You want to look at, there are well-written kind of objectives and things that are not quite as well. And one of the goals to maybe if it's exercise for yourself is maybe to write 3 and look at that. We're going to give a whole series of references here of things to help you to be effective in going through that. There are certain things that maybe we were demonstrating in the past to do, and we write objectives and we're going through things, but there are better ways to go through that. So example, in the past, many of us would say, identify, several factors here. Well, what they want to look to is get an action, appreciate, understand. Make sure that they understand that it's also going beyond just rote memorization, but also it's impacting their attitude. We'd say differentiate, instead communicate, be able to know, describe something. Instead, maybe to say, learn how to. Instead of recite, going through it, be aware of, enjoy, know how to. Perform means implement. So again, in action, and demonstrate, be motivated to. You want to move the learner to that next level of going through things. So again, what are kind of good, what are, not as good to do it. So, when you could do, acceptable on a clinical skills examination, the student will recite the principles of muscle energy. Clear out to do. But if we say the student will understand the principles, it gets through, but the other one really shows a little more definitive. It's more focused where they're going. On the written exam, the student will be able to identify the steps to a counter-strain treatment. It's really is more clear than saying just student will know the steps of counter-strain treatment. So in other words, sometimes you say, well, that's playing on words. It does, but that little play also changes the dynamics of our expectations and again, moves more to an action phase. Just throwing out some other references here, there are other things themselves that you can look at getting additional training in doing this, and they can look at ways to help write objectives because this is very tough. And many of us are developing, again, rotations, developing different coursework for the schools, even a presentation. This helps give you much better ones to go with so you can go to these other websites to do that. Learning things is one thing, but also assessing it is becoming exceedingly important. How do we know that they really have gained that knowledge? How do we know we're developing competent physicians? Well, we're using many things. OSCE, global rating scale, standardized examination, 360 degrees. When you develop tools and you're looking at different areas, different rotations or presentations, don't forget to incorporate osteopathic concepts into those areas. And that's very helpful as you're developing those tools. So as an activity for yourself, think of things that you plan to do. Look at, if you're developing a course or a presentation, just a brief outline of what you would like to do. And you should look at some activities that's specific to the content and getting themselves. And then think, how can I put osteopathic concepts and incorporate that into it? There are many ways to get people engaged. One of the challenges since the MTV has come on and attention span with TV in the past is demonstrating that after so much time the learner starts phasing out. We are not all trained actors and going through things, but we have to find ways to get people engaged. The audience response system has honestly become very popular, and they'll do something to maintain that attention, create an interactive environment. The parent-teacher approach where the instructor sits there and talks down to people, and the student takes on more of a child role does not allow that active engagement. We want to look at that. We want to get them motivated. We want to get them, involved in it. So, one area themselves may have, even areas like PowerPoint, it's been a standard, but I think people get kind of PowerPoint burnout. But if you change it and you add some things into it, it may help make it more active. So let's say example. You put down to in front of the students, I understand the meaning of the term somatic dysfunction. And let's say it's an audience that's, kind of the first year class is just coming into medical school, and they say, okay, 1 strongly agree, all the way to 5 Likert scale of strongly disagree. Well, if they do that, in the end, you make a look and say, well, I think most of these people get it. They understand, most, starting off here, over half of them get what's going on with this or not, but very few don't get it. But let's say, again, now we moved our question and we changed it. So we think of it, that we define somatic dysfunction so people understand that, but do people really understand that definition we're going on here, somatic dysfunction? But let's say we change it and we said, I can identify or recite or write 4 diagnostic criteria for diagnosing somatic dysfunction. Well, now it's much more specific. It's much more guided. What happens if we do that? All of a sudden, we find the same audience may come back and say, since you put it that way, I really don't get that. So initially, your assumption by how you wrote the objective, how you approach your learners may give you a false idea of where they're at as learners. And being more specific and also more active, involved, and engaging, you'll pick up that's not quite the case. Because then they'd have to know, do they understand TART, tissue, texture abnormality, asymmetry, restriction of motion, and tenderness, which are elements of somatic dysfunction, and they may not have recognized those areas. Also being more specific means when they're being reevaluated, it'll keep it in mind a lot more. They're more effective in retaining knowledge themselves later. It's a different generation of learners, and I think all of us learning things. The iPhones have taken off tremendously, and the apps from getting themselves out of iTunes has been very, very popular, and other areas themselves. And they can use it on their phones, they can use it on tablets, they can use it on multiple things. There are things in the medical education now that have really got our learners engaged, looking at anatomy, cardiac sounds, a lot of things. But it's also something available for osteopathic concepts. The American College of Osteopathic Physicians has done a really nice job with this. They have something called Do OMT, and they have an application there that allows them to look at osteopathic procedures, to define terms and going through it. So that's one area recommended you could use for learners, and because many of the places we're at, especially in postgraduate training, maybe a few people that are more fluent in osteopathic concepts think, gee, how can I do this all by myself? You don't have to do it by yourself. You can use these other tools. And again, one of the core competencies looks at practice-based learning, developing the adult learner. These are nice tools to help do that. We can't all do it by ourselves. And more of the Opties and other organizations that are sharing resources together are using a lot of distant learning and helping themselves. Webinars being much more popular. And these things are very helpful for using, especially in areas of training in osteopathic concepts, because again, we may not have as many people that develop expertise or comfortable enough to initially to do that, and those things may help out. Also working with reading. One thing that's very helpful is pre-test and post-test. It helps see where learners are at in relation to anything they're doing themselves. And looking at themselves. So, when you're looking at these other skills that may help us looking at this, there are, this area himself also helps in areas, to develop people on the site who maybe can be guided in doing things that, gee, how can I do that? What happened is the on-site faculty then can be kind of training table trainers to assist with it, and someone who is also, let's say, me leading it may also describe, here are the techniques we go through, let me show the techniques and how we're going to go through with that. So what I've went through today is that, in medical education today, especially in osteopathic medical education, we don't want to lose the unique element we have, which is our osteopathic concepts. When we develop curriculum, when we're looking at areas that we're developing to train our learners, again, the setting, giving a talk, running a course, making a rotation, developing a whole residency program, putting it together, we want to make sure we do not lose those osteopathic curriculum elements for a few reasons. One, it's required for accreditation, but more, it's important for developing the learners we want. It's something unique. And it's something that learners are honestly looking for in our training programs. Gave a couple hopeful hints today that hopefully will help you to look at developing goals and objectives, and these learning objectives when you're doing this. And again, looking more in action, looking at the new Bloom's taxonomy, looking at other tools that may help us out. Also tried to hopefully give you some hints to looking at models for looking at curricular, instructional design that can look at this osteopathic concept or ways to make that go. And think of other methods to incorporate it, into the curriculum and instruction, in all years of training. From again, the first year they walk in to the end of their fellowship, and again in CME programs and going on from there. There's, again, looking at the sources, we want to make sure we have things to, we provide to our learners, and we look at themselves and give them additional information. So every time we do things, trying to provide extra sources to help our learners is really important. We also have a tool on the website themselves as a syllabus creator in doing it. We have developed that from a lot of resources from different individuals who have developed that, and that'll be available to accompany this to kind of walk you through these steps. You said, boy, how can I do this? This will help step you through it to get a tool. So again, thank you very much for joining us today.